There are many different types of healthcare organizations. Under healthcare services, there is prevention. There needs to be a great deal more funding under that auspice. With prevention, that could drive down a lot of the expense in healthcare. It would also lead to more people being healthy and living a lot longer. Prevention would also be a lot cheaper care than people that have ongoing medical issues such as type 2 diabetes, which is totally preventable. Giving people options as far as how they receive care has changed a lot over the years. For instance, Kaiser Permanente, which is an HMO, this type of care is hugely popular by those that enjoy having all of their health care under one roof. They can see their doctor and get their laboratory testing done all in one facility. They don't have to travel across town in order to get several different tests or see several different specialists. It's all right there. These type of facilities may put an end to solo practitioners and specialists. Trying to meet the needs of everyone is difficult, especially for those that are uninsured or underinsured. One of the organizations that seems to be filling that void are retail clinics. These clinics have listings with pricing so that it's clear on the amount you will spend to be seen by either a doctor, a physician's assistant, or a nurse practitioner. In Jonas and Kovner, it says recent years have seen the introduction of several innovative new models of care that have potential to realign incentives and improve overall health system performance in terms of cost, quality, and access. I believe that is an example of those innovations. There are many different people that make up the healthcare workforce, and it includes doctors, nurses, radiologists, for example. There aren't enough people going into the medical fields, and one of the reasons is the amount of time that it takes to get the education, as well as the cost of the education. Another reason that people don't go into the field is because they may not make enough once they're finished the education to pay back the loans that they've taken out. Another thing is the way people pay for the services that they receive, and they're varied by several different programs. There's private health insurance that most people get from their employer. There's Medicare, which most Americans over the age of 65 have, and Medicaid, which is income-based. It's all governmental. And there are several other programs that are also government-funded, like CHIP, the child health care for children, to make sure that children are covered. So we've learned quite a few different things for these weeks, and it's been a really, really insightful for me for some of those issues. And I just want to say thanks for letting me talk about what I've learned.